Hey guys, so welcome back to the intersection of medicine and politics. So I wanted to talk a little bit about how things got politicized when it comes to the COVID 19 pandemic. So, if you guys remember back in March of 2020, when the first lockdowns went into effect, and we started to see cases coming over from overseas, from Europe, from Asia, as far as cases of COVID 19, and everyone was looking for guidance on what to do. The initial recommendation from the CDC was not to wear a mask. And, we know now that that came from not from the idea that masks don't help. You know, yes, there has been some leaked emails from Dr. Anthony Fauci that have mentioned that he did not feel, based on the data, that masks really helped much. Of course, that's counting all kinds of masks. I think we all in the scientific community believe that masks help when it comes to something like this. Any respiratory virus, masks are going to help. No question. There's no debate. There's not even, the science does back that up, but also common sense backs that up. Now, why did the CDC come out at the beginning and say that they didn't want people to wear masks? Well, as you guys all know, um, this was because they wanted to save masks for healthcare professionals. Healthcare professionals who are going to be working with COVID 19 patients, healthcare professionals who are just out there, essential workers who are out there who are going to be interacting with people who may or may not have COVID 19. Again, we didn't have a handle on things at that time. We didn't know everything that we know right now. And I don't mean to be an apologist for the CDC. I think it was wrong. I think we should have trusted the American people and told them, look, masks absolutely help against this virus, but we don't have enough of them. We haven't manufactured enough. We don't have the capability to produce masks yet at the level to provide enough for the whole population. We don't have enough N95 masks. So if you guys could band together, be patriotic, stay at home, we're going to cover your salaries. We're going to make sure you're whole. We're not just going to leave you out cut to dry with this horrible unemployment sort of scheme that came out of all of this that helped some but not others, people with long waiting lines. I think we needed to take care of people in that moment, and it would have saved us a lot of money down the road. Okay? And if we had done that, we had locked down properly for a short amount of time, everyone was on board with this. Everyone who was an essential worker got masks. I worked in the hospital. They didn't even let us wear masks at the beginning. They told us specifically that we could not wear masks. And then they flipped the script, right? So, American people, yes, you guys were told not to wear masks. We were told at work not to wear masks. And that unless we were sick, someone I know was told that unless they were pregnant in the hospital, they couldn't wear masks, even though there were cases of COVID 19 happening. And I'm not going to say which hospital. I'm not going to, get anyone in trouble. But you have to understand, like, that's huge, right? To be told when we all know that masks help. And I knew people who were telling people, "Yep, I'm pregnant. What are you going to do? Prove it? How are you going to tell that I'm not pregnant, right? I'm protecting myself. I'm protecting my family." And so, masking became this huge debate, right? And the inconsistency is what led to so much politicization politicization of the debate, right? Should we wear masks? Should we not? We had all these anti-maskers. We had people walking around saying, "I'm not going to wear a mask," and this should have been a unity issue. This should have been something where we could all been united. People start making masks for each other. I mean, in our community, we had people down the street who were making masks and red, white, and blue masks and everything. I bought some from them. This is something that could have been something that brought us together as a country. We're so partisan. We're so spread out on all the issues, and that's fine. We in actuality, a lot of the American people agree on a lot of issues, but when it comes to medical issues, when it comes to public safety, when it comes to public health, this is not something that should be politicized or partisan at all. This is so crazy that this happened. So again, masking was a huge part of this. And, with all the unemployment and businesses shutting down and the lockdowns, I'm going to talk about that in the next segment. Um, this was only meant to happen. There wasn't a way to avoid this.